In this video, we discuss postural orthostatic tachycardia syndrome treatment. But is there such a thing as a cure? Stay with me to find out. Postural orthostatic tachycardia syndrome treatment is geared upon patient education, symptom control, and physical conditioning. There simply is no cure. Upon standing up, about 500 cc's of blood immediately leaves the thoracic cavity and pools in the legs, the lower abdomen, and the buttocks. Our bodies have mechanisms that compensate for this by increasing the heart rate and raising the blood pressure. In patients with POTS, these compensatory mechanisms, malfunction, leading to excessive racing of the heart and the typical symptoms that accompany this disorder. Patients with POTS experience lightheadedness, palpitations, tremulousness, blurring of vision, exercise intolerance, and breathlessness after standing up on their feet. Several mechanisms have been proposed as possible causes of postural orthostatic tachycardia syndrome. Some patients have a hyperactive nervous system in what is called hyperadrenergic POTS. Some patients have low blood volume in what is known as hypovolemic POTS, and still others have a malfunction of the nerves in the lower extremities known as neuropathic POTS, and which leads to the abnormal pooling of blood in the lower extremities. Because of the various mechanisms involved in the causation of this syndrome, some treatments and medications work in some, but not all, POTS patients. The first step in the treatment of any patients with POTS is the withdrawal of medications that may be causing or aggravating the symptoms. These generally include psychiatric medications and certain types of birth control medications. Because patients with POTS generally have poor cardiorespiratory fitness, they should begin an exercise program that includes aerobic as well as resistance training, with a focus on improving the muscle tone in the leg muscles and the core body muscles. Patients with breathlessness experience marked improvement with breathing exercises, but this generally requires the assistance of a respiratory physiotherapist. I've included a link to our website where a comprehensive exercise program can be found in the description below. Patients should be encouraged to increase their fluid intake to 2 to 3 liters per day and to increase their salt intake up to 10 to 12 grams per day if necessary. This frequently requires the use of salt tablets. In addition, patients can wear compression hose that prevent the pooling of blood in the legs. Hoses that extend all the way up to the lower abdomen work best. At other times, patients can sleep with the head of the bed elevated on blocks. This expands the volume of blood in circulation and decreases symptoms. If those initial therapies fail, we can turn to medications. Fludrocortisone is a medication that causes the kidney to reabsorb salt and water and to expand the blood volume, whereas desmopressin is a drug that allows the reabsorption of water in the kidneys. These drugs work best in patients with low blood volume or with hypovolemic POTS. Midodrine and pyridostigmine are drugs that improve the tone in the blood vessels and help to maintain the volume of blood in circulation upon standing up. The racing of the heart can be controlled with the use of blood pressure medications known as beta blockers, especially propranolol. Ivabradine is a drug that also slows the heart rate down, but without the side effects of beta blockers. For those patients with a hyperactive nervous system, that is hyperadrenergic POTS, medications that inhibit the nerve impulses in the brain, like Clonidine Methyldopa, work best. Finally, Droxidopa and Modafinil are drugs that can decrease the brain fog and fatigue in patients who suffer with those symptoms. I hope you enjoyed that video. If you did, like, share with friends and family, and leave your comments in the space below. Support the channel by subscribing, and don't forget to hit the notification bell so you can be notified when new videos come out. Thanks for watching.